who is indeed the head of SPACO, the Special Presidential, Committee on
Mary Bro.
COVID. No, no, on
Oh,
COVID.
okay,
That
on
is the
COVID.
president.
Okay,
The president is the chair of that special task force.
okay.
And so we want to say a big thank you to him for all of the support and everyone else. In terms of health workers, we had about 404 cases, amongst health workers, and we lost 8 health workers during this process. So total recovery we have had thus far 7,199.
Since the start of COVID.
Yes,
Okay.
7,199.
Okay. Now, so give us an idea as to whether those cases are mild or they are moderate or they are severe cases.
Sure. So again, we want to say that those cases are all mild.
Oh, they are all mild.
They are
Okay.
all mild cases, and this is why you see me in here in studio. There are a lot of things that have led to that, and so in this public manner, and thank God you have called me to give me this platform to say a big thank you to the people of Liberia.
Okay.
We have done very well as a country. I think one of the things that I always say that do not underestimate Liberian. When we make up our mind to do things, we do it to the end. And so, one of the reasons why we are not, because I know that will be the next question, why are you people not enforcing and so forth? So basically, when you are dealing with an infectious disease and so forth, we look at herd immunity. And so to meet herd immunity, your total population, you need around 70%. Today, as we speak, Liberia have exceeded, in terms of our national coverage, we have exceeded that. So 82% of the targeted population we anticipated to be vaccinated have been vaccinated.
82%.
82%
Of the total population.
of the total targeted population.
Population, okay.
Yes, 82% have been vaccinated. Now, if you look at the total population, because WHO uses the total population, so we are about 54% of the total population
Okay.
being vaccinated. That is excellent. If you look at other African countries, Liberia is doing very, very well. So to give you just a little statistics of how this happened. So total vaccinated as of yesterday, 3,000,000 900 900 no 3,009,296. 3,000,000
People.
yes, 3,009,296 persons have been vaccinated. Those that have been fully vaccinated, 2,496,335.
When you talk about fully, what do you mean?
So when we talk about fully vaccination, you know that some of the vaccine, for example, the Pfizer, you have to take two jab in order to be fully vaccinated. If you take the J&J, just one jab, you are fully vaccinated. So those that have taken the J&J, yes, they are fully vaccinated. Those that have taken the Pfizer, so some of them have, and some of them need to take their second jab.
Okay.
So this is where you have fully vaccinated and vaccinated. So if you are fully vaccinated, then we are sure you have protection at least to what is anticipated. If not, the total protection is a little minimum. Now, what else are we? I told you that the national coverage, 82%. But let me tell you something that is so interesting. Mosorado County, we have close over 95% of the targeted population in Mosorado County have gotten at least a dose of vaccine.
Okay.
Nima County exceeded the targeted population. They have got 100% plus of targeted population being vaccinated. And other counties are doing very, very well.
Okay.
Trying to get there. And this is why we have reached the level we have reached. So in terms of healthcare workers, we have 13,843 healthcare workers being vaccinated, and that constitute 86% of the healthcare workers that we have.
Okay.
And so because of the coverage that we have, so just in case, even if someone were to have the infection, the probability of it going to severity is very, very minimum. And this is why we're having mild cases and so forth. And this is something that I'm throwing out there, and this is for scientific debate. But I mean, one of the things that I always say is that I think something that have blessed us and blessed the world is Omicron.
Okay.
The reason is that, and we still have to prove this. This is a hypothesis that I'm thinking about, because I'm looking at how did we come to where we are now, especially globally.
Surely.
And so, Omicron, basically, the transmissibility, infectious rate was so high. So many persons were exposed, from my own hypothesis, have been exposed to the vaccine. So everyone, to some degree, have built some level of immunity. And so when Delta or Alpha hits you, your body tells
You're
you
not
that
broken.
you're not broken, and so this is what it is.
Unlike if you are not vaccinated.
That's right.
Now,
And so we think this is what is leading us globally to have some flexibility from one country to the other.
Now, so the mild cases you are making reference to, where are those individuals now?
They are home.
Oh, you got them in home.
They are in their
But
their
are
homes.
they not a risk to their families?
No, not really. I mean, we have reached to a point where we know exactly when you are at home, you are being taught what you have to do and so forth. And people, one of the things that a person would do, especially someone who loves his or her family, will be first to protect that family. So if you were to have it, you don't want to expose that to your mother, your grandmother, or someone who may have a risk of going to severity. So you will try to follow all of the ordinances and everything that is put in place in order to make sure that you do not become the weapon to your own people.
Now, Dr. Kateh, I know I heard before that even if you are vaccinated, you are still under obligation to wear the masks, to follow all of the protocols. But that is not, being enforced anymore.
Yes, and the reason is that globally, and what we are looking at globally, is that this herd immunity. So when we did not have this protection, it was mandatory. You saw me walking.
To follow the protocols.
You saw me walking in here.
Yeah, I didn't see you with mask.
You didn't see me with mask.
No, not at all.
Because besides taking...
Not on a can of sanitizer.
That's right.
Like we used to hold before.
Besides taking my 2 vaccines, I took the AstraZeneca. I've also taken my booster, the Pfizer. I took the Pfizer in February. And by October, because of the work that I do and so forth, I'm taking another booster. So, I mean, if you do that, even if you were to get it, the risk is minimum. And this is what we are reading from the data. This is what we are seeing, and is becoming a reality.
Now, so try to educate us today, Dr. Kateh. You brought in the issue of the booster, which is good. If, let's assume, John Brown took the J&J, which I love, and I took the Johnson & Johnson, do you also have to take a booster?
Sure, because what happens is that, Sorbor, we are still following the protocol. We are still studying this disease. Like I told you once, Ebola, the first case of Ebola was in 1976. And up to 2015, it was in Liberia that we realized some of the tentacles of Ebola. Because, those countries that had it, especially the DRC, Congo, and those places, every 3 months, 4 months, you hear an outbreak. Sometimes every 5 to 6 months, we heard an outbreak. So in Liberia, this is where we actually realized that even though based on research that was done and studies, that after 90 days, a person who is a survivor is free to enjoy God's blessings that he has given to men and female. Now, we realize that in Liberia, a young man went over 150 days following all of the rules that we have given to him. And then he wanted to enjoy himself God's blessings, or the apple, and infected a lady And unfortunately, that lady lost her life. And because we tested her, we knew it was due to Ebola. And we're able to find this young man, and we're able to get his sperm. And we realized he was still purine, releasing active virus. And this has changed the global perspective on the advice that you give to someone who is a survivor. So just imagine, from 1976 to 2015 is when we realized this, and that was done from Liberia.
Okay.
Now, just take for example, COVID had just started. So we are still testing how long will the immunity last? What would be some of the sequelae, some of the problems that may occur? So we still have to do a lot of research. We still have to understand this. And so as science improves, basically we learn more and we try to inform the general public.
Now, you've painted the picture now, Dr. Kateh, that we are not off the hook here for COVID. It means that COVID is still in our midst. And now, when do you think, Dr. Kateh, and what is being done by the Ministry of Health to see this country being off the hook in the soonest possible time?
There is no way this country can be off the hook.
Why?
Because one, this is global. It's global.
But COVID, but we had Ebola. Ebola came and it was regional. I think.
Yeah, sure.
And finally we became off. We got off the hook of Ebola. Why COVID is still giving all of you hard time?
Sure. So when it came to Ebola, Ebola was just the three countries: Liberia, Sierra Leone, Guinea.
And Guinea.
Now, guess what? Liberia was the first country to be declared Ebola free. What did we do? And what people may not understand, we had some Liberians that are still here. Some of them were serving as advisor to Sierra Leone, to Guinea. Some of us went into Sierra Leone to give them some ideas how to get to zero, because we deploy different mechanisms. And we're doing this because, yes, we put out the fire in our house, but we realized that there was still fire in our neighboring countries. So in order for us to live peacefully, we decided to help our neighbors to put off their fire. And as long as their fires were put off, definitely we could comfortably say, yes, indeed, we are okay.
That was Ebola time.
That was Ebola time.
Now let's come to COVID.
COVID.
Why you can put off the fire on COVID now?
How many countries we have to go to? But how many countries? Even with all of the, even where it came from China, they're still fighting with every draconian measure they are taking. Every time you find them coming down and so forth.
Now,
so
you're giving us, you're making us to understand, Dr. Kateh, that it seems that in our country, we'll have to live with COVID like we are living with malaria.
Globally, it's what we are getting to. So what we are doing,
which is terrible, Dr. Kateh.
I don't think it's terrible, because it's the same thing. When you had influenza, you had all of these things. These were things that initially killed thousands of persons. But it got to a point where, as long as vaccine was discovered and people began to build immunity, it became mild. So what we do is that we transition into our routine services. So very soon, Liberia is transitioning the COVID vaccine into routine services and so forth. So this is something that we have to live with.
When you talk about transitioning into routine services, what do you mean?
What it means is that we have various kind of vaccines that we give to people. For example, you have influenza, vaccine. You have basically, for example, you have typhoid vaccine and so forth that we still have. So when you go to the clinic and you feel that you want it, we will have it there and you can take it.
So it means that you're going to import the vaccine religiously because we still live with COVID.
Definitely. So, and let me tell you quickly that even though we are at this point here, but we still anticipating more vaccine to come because we can keep them. So, for example, we are anticipating in the pipeline, we are anticipating close to, we have 425,880 doses of Pfizer will be coming in the third week of July.
Okay.
So we still have a lot of vaccines that are coming in, and we're going to keep them, in our stockpile. And then it is put within the routine services. So if someone desire of being vaccinated, definitely, especially for the elderly and so forth, because we are still studying this. We don't know how long the immunity is going to last. So this is why we have the booster, and people can go in and get their boosters.
Now, let me ask you. Let's assume you took the Pfizer or the AstraZeneca. I know I like the two names and the J&J. If you took the Pfizer, let's assume, then you want to take a booster, can you take a booster of the AstraZeneca? Initially, you took the Pfizer, though. Can you take a booster of the AstraZeneca?
Sure, you can do that, even though we do not have...
It wouldn't be a problem, Dr.
No,
Kelly?
it won't be a problem.
Because initially we heard from you all that you can take the different vaccines at the same time.
So it's the... You say, that's the right word you just used. At the same time. No, you cannot. But you can space them. So, for example, if you
I
want to...
took my J&J last year now.
Yes.
Can I take the...
Oh, sure.
Can I take a Pfizer
You can do...
AstraZeneca this year?
You can do that.
It won't be a problem?
No, it won't be a problem.
Tomorrow when there's a problem, what happens?
Hold me responsible.
I like that. You're listening to the SMS right here on the OBC, 99.9, and other frequencies across Liberia. Our studio guest on the first lab of the program is Dr. Francis Kateh. Dr. Kateh is the Chief Medical Officer of the Republic of Liberia. So to transition from the issue of the vaccine now, Dr. Kateh, you said we are expecting more vaccines in the country in the shortest possible time.
Yes.
So
and we have close to almost 1 million plus in country.
Okay.
And we still anticipating more coming.
Okay. Now, so give us an idea. Somebody who has the COVID, but their condition is mild. What are the symptoms? So that I know when somebody is presenting that symptoms, I can run from them.
Basically, we're getting a lot of asymptomatic cases. So how are we picking up these cases?
Okay, that's good.
Either someone is traveling out of the country and they go, because now there are few countries where when you are going, they still require you doing a COVID test.
Okay.
Now, most of the countries have become so flexible. They have relaxed those restrictions. For example, the U.S. As long as you have taken your vaccine and you have your COVID vaccine card, you don't need to take the test in order to go to the United States and so other countries.
They dropped that.
They dropped that.
Okay.
So we are picking up people that are traveling to countries where they feel the requirements are still in place. Another thing again is that individuals may not be feeling well and may feel that, okay, this is malaria that I have, and they have taken out of the malaria medication. Instead, they are still having some, weaknesses and other things. So they just go and say, look, let me just rule out, what I'm having. So they do the COVID test and they are positive and so forth. So basically, this is how we
people
want
of
to
that
do
nature, they do not present symptoms.
you won't see much symptom. No, we are not seeing people presenting symptoms nowadays. No, so it's more asymptomatic.
Okay, so now with the situation at this point, please take this call for me. With the situation at this point, Dr. Kateh, 9 cases you've just said, and those cases are not severe. They are not moderate. Rather, they are in the mild category. Does it mean that we can now relax the enforcement of the protocols where people are constrained to wear the mask and wash their hands and all of that?
We cannot move that. The thing here is that, life self-preservation is the key. And I've always said that. So as an individual, you always have to do whatever you can to preserve your own life. And so remember, Sorbor, some time ago before COVID, there were people running around saying, oh, my typhoid is starting again. Today, from the hand washing and so forth, you don't see that many persons now complaining. So hand washing is something that is very critical. Biblically, it said cleanliness is next to godliness. So these are things that we think should be routine.
Okay.
So these are things we need to do,
But we should do it regularly.
Yeah, regularly, especially washing your hands religiously is
Okay.
very, very critical.
Okay, so you heard Dr. Francis Kelly say we still have COVID in our midst. He said we got 9 cases, but those 9 cases are all mild cases. They are not moderate. They are not severe cases. He said, well, we still need to continue with the health protocols, washing our hands, and one of the things he stressed that we need to take our booster. He said if you took maybe the J&J, which is the double dose, you can now go to other vaccine center and take out of the AstraZeneca as your booster or the Pfizer as your booster. He said nothing's going to happen. Just rest assured. If anything, he said we should get in touch with him. He'll be held responsible. Now, Dr. Kateh, where are we now? Because that one problem that we often experienced in the sector, this issue of the availability of drugs and medical supplies. Where are we now at our government-run hospitals?
Sure. So, Sobol, I think let me break this down because many a times I'm sure a lot of people do not understand the enormity of what we have to do in terms of running health services.
Okay.
So, the health system in Liberia was basically the structure follow that of the United States. So if you remember then, the Ministry of Health used to be called Ministry of Health and Social Welfare. Now, what that happens is that in the United States, you had it is called Department of Health and Human Services.
Okay.
The portion of the social welfare was taken and given to Gender Ministry. So within the Ministry of Health, we have two major cardinal rules. But at the same time, we also have a role of policy and monitoring,
Okay.
setting standards and so forth. Now, you have the preventive services and curative services at the ministry. So you have two assistant ministers that works beneath me. Now, under the preventive services, we still have so much that we have to do. The family health division, malaria, HIV, and so forth, those fall under preventive health services.
Okay.
Under curative, you have the clinics, you have the hospitals, and so forth. So sometimes when we talk about it, people may not understand. So when we talk about clinics, how many clinics are we running in the country? Now, that is the change from what is done in the United States versus what is happening in Liberia. In the United States, the Department of Health and Human Services does not run facilities. In our country, a developing country, before then, they used to do that. But as the economy improved, people went into private facilities. So most of the facilities are either private or run under some other mechanism. Now, in Liberia, from the last statistics count we did, we have about 953 health facilities around the country.
Okay.
953. Of that number, 511 are public. In other words, they are being run by taxpayers' money. 442 are private. Now, of the 511, you have, of the 953 facilities we have, clinics constitute 823. Now, with clinics, you have different types of clinic, but in general, 823. Now, you also have health centers. We have 93 health centers in the country.
Surely.
We have 26 hospitals in the country. We have school-based clinic, 4 of them, and we have health post, 6 of them. So that's the breakdown of the facilities. Now, of the 26 hospitals within the country, the government runs more than 20 of them.
More than 20 of
More
them?
than 20 of them.
Okay.
So,
Across the entire country?
across the entire country. Now, so if you look at the public facilities, 511, it is very massive. And this is what makes the way health system being run here a little difficult, sometimes challenging. Now, all of these health services, remember some time ago, out of word of mouth, we had this thing called free healthcare service,
Sure.
which of course we have not seen any document to what proclamation was made constituting that. We haven't seen that. But again, how do we move from that level to the other level? Let me tell you another thing again, Sober. You know, when you are going through crisis, you become dependent. And when you are dependent, a lot of people come over to help you. Now, if you are not in crisis, like what we have, and we are so grateful to this government and the previous government for stabilizing the country. And because of the stability that we have in our country, now we have left the crisis situation. And because we have left crisis situation, now we have become independent. And when you are independent, you need to now fend for yourself. And so we are at that place where we are fending for ourselves, finding different means to see how we can effectively provide quality
Let
care.
me bring you back to the question that I asked, Dr. Kateh. I know you tried to mesmerize, but I enjoy that. Now, when are we, Dr. Kateh, now the question I asked, with the issue of the availability of drugs and medical supplies at our government-run hospitals?
We are not where we want to be. We still have some challenge. And to give you what has led to this challenge, this is why I was giving you the background information.
I agree.
But again, so this is where we are. We are still challenged. Because before then,
So if you went to our hospitals, you'll not find drugs?
You will find-
Rather, they will give you prescriptions?
no, you will find medication.
Okay.
But the point here is that, and this is where we are going, we are looking at it from different perspectives.
Okay.
Now, when people say there are no drugs, you need to go, and individuals that will call, ask them, when you went to that facility, was there no single tablet or not? Because, sometimes we generalize things. So if you go there and you did not have your antibiotics, that does not mean they had no anti-malaria, or they didn't have any antipyretic drug, that is paracetamol, ASA, and other things, or they didn't have a deworming drug at the place there. But because you went there and there was that particular antibiotic that was prescribed for you is not there, so it is generalized that there was no medication. So at our facility, to some degree, every day you went there will be some medication. Now, do we have all of it? No, we don't. So what we are doing now is that sometimes some of these medications stay there and expire.
Surely.
Because we also have to think about the kind of disease burden. What are the diseases now that we are fighting, that we're seeing commonly? So that we need to revisit, which we are about to work on, revisit our essential medication list, so that we can make sure that it forms, it becomes, it fits the present reality.
Okay.
For example, we have now clinical pharmacists. We are also tasking the clinical pharmacists to work with the doctors, looking at the disease burden at various facilities around the country. How can we now come up with a new, revised, essential medication that will be appropriately, covered in terms of resource mobilization, in terms of funding available based on whatever funding we have, that we can cover this. So as we move towards the revolving drug fund, these are some of the things we are putting in place, so that at least in not too long distant future, if you are to go to a facility, whatever medication that is needed will be there, and you don't have to take a piece of paper to go.
Let me ask you, how often do you supply your facilities?
We do that quarterly.
After every 3 months?
Yes, we just completed. We completed not too long ago the first, and now presently other counties, some counties now have received their second quarterly distribution. So we are working on that. So if you were to go to the Central Medical Store, you will see people working there, doing what we call pick and pack.
Far to rich area, the rural area, Dr. Kateh, how do you supply them?
So we have a mechanism.
Especially during the rainy season.
Oh, sure, we have a mechanism. And this is something that we've been working with for a very long time. So, for example, out of our hospitals, government-run hospitals, we do last mile distribution to those hospitals. And working with Global Fund have contracted WFP So WFP is the one that is doing our last mile distribution. So they take them to all of the government facilities, the hospitals. They are taking them. For the clinics, they are deposited at the the county depot. So in every county, we have a drug depot. So they are deposited there, and it falls within a purview of the county health officer, the county pharmacist, to do the last mile distribution. And funding resources are sent to those county in order to make sure that the last clinic in the last village received their donation, their stock of medication. So if you were to go to places like Riverside or Grand Cru, you will see people carrying supplies out on a motorbike because vehicles cannot reach there, or on a canoe in order to cross certain rivers to get to the last facility.
You are giving the statistics about the number of health facilities and clinics. Dr. Kateh, this is one of the headaches that the Ministry of Health has, and I think I stand to be corrected though. Often politicians will go and build these sort of clinics to yield some political dividend from the people. But at the end of the day, those clinics are abandoned. The operations of the clinic, again, comes back on the lap of the Ministry of Health. Have you been able to address this?
Sure. So this is something that we all keep talking about. The ministry is one of the most decentralized system within the Liberian government. So, for example, Sorbor, if you needed any information from any county or any part of the county, I can give you that information within a couple of minutes because I just need to send information to my county health officer and tell him I need this information from this so clinic, and within split second, that information will get to me. So, what we also have done is that we have basically looked at every county and decided where we will have population growth, where we will have a particular clinic, whether it's primary level 1 or primary level 2. And many a times I tell people, the easiest thing to do is to build a building. So when you build this building, that does not mean it is a clinic. It becomes a clinic when the equipment, when the supplies, and when the staff are there. Then it becomes a clinic. So, building these buildings around causes problems. So if you have some resources, go to the county health officer. Ask the county health officer, I'm interested in the so-and-so village. For example, in Maryland County, you say, I'm interested in Suasu. Nobody will know where Suasu is, except you are from the Calocan area. Where is I want to build something in Suasu. That county health officer will look at the map and say, okay, yes, you want to build that, but, instead of building in Suasu, build it in Waterken, because Waterken is much bigger. And so patients from there will walk up to Waterken, and people from Kunuso can come to Calocan and so forth. So we have that map. So it is important that people follow these things. We are not stopping individuals from helping the government. It is the role and responsibility of the government to provide health care to all of our people. Okay. So if you want to help the government, let us do it collaboratively, but let's follow the system so that if you know that, we also have a design of what a clinic needs to be built. If you want to build it, how it has to be built. So we have that design. If we follow these things, all of them help a lot. Okay. And so we hope that not only lawmakers, but anyone who wants to build a facility for the public, please go to the county health officer, talk to the county health officer. They will give you those necessary information to help you. So at the end of the day, it becomes a win-win.
You're listening to the SMS rated on the OBC 99.9 and other frequencies across Liberia. Our studio guest is Dr. Francis Kateh. Dr. Kateh is the Chief Medical Officer of the Republic of Liberia. Now, Dr. Francis Kateh, let me try to get your take on this whole debate that's sparked as a result of the new efforts by the ministry to revive your drug law. That's not a drug law, the new public health law.
Sure.
There's been this debate about how people are looking at making abortion illegal, or making it legal, in fact, in another word. There's been, since the issue came in on the floor in the legislature and even in street corners, people have been discussing it, and there has been this whole mixture of views. There are some who think it should be, and there are some who think it's bad and shouldn't be at all. Making abortion legal. You've been the chief medical officer of the Republic of Liberia. I want to carry a big story today. Where do you stand? Quoting you.
So, Sorbor George, to answer your question, let me just give you, in just few seconds, something that happened to me personally.
Okay.
This is something I don't like to talk about. When I graduated as a young doctor, I've been a medical doctor since 1995. And I've always said abortion is something that I won't do because of my religious belief. But I'm not going to say the place. I was working in an area where my pastor, the pastor of my church, had a daughter who was 14 years of age and got pregnant and came to me and asked me to abort. And I told him, Pastor, I can't do it. About 8 hours later, I was called in the emergency room. And when I went there, I saw this girl. Now, this girl went to a quack. This quack went ahead, perforated the uterus at different angles. Not only that, a part of the intestine of this girl came out. This quack took a scissor and cut part of the intestine. When he saw the feces, he panicked and ran out. And when I saw this girl, what I had to do was to do what we call a subtotal. Remove this girl's uterus because there was no way we could have saved it.
To remove the uterus?
Yes. Not only that, I had to do what we call end-to-end anastomosis. Cut part of the intestine because part of it was already getting infected. So I had to cut it and rejoin the intestine. Today, this girl is in her 30s, almost her 40s, early 40s. This girl cannot have a child. Every time I enter the United States, she will always call me. This girl has been divorced twice because she could not give, she cannot have a child. What we are doing is not criminalizing or legalizing abortion. What we are doing is to save the life of a person. If a woman, it doesn't matter how you term it, if a woman is pregnant and she wants to terminate that pregnancy, we want to do it safely. We don't want her to go behind the house. We don't want her to go to someone to take stick and pour it into her. We don't want her to take some kind of blue or whatever liquid and drink it that could cause her a long-term complication and have this thing that will psychologically have an impact on her every day. Where whenever she goes out, she won't be able to get a husband or get a child because a quad did that. If you look at the present law today, that people thinking that we need to, it has given different scenarios. It has given the right to a woman to self-induce abortion. She can do it herself. So this is not, so it's not the matter of legalizing abortion. What we are trying to do is to make it as safe for anyone who needs that second option. And this is what we are doing.
So because of the experience you had, Dr. Kateh, so you've subscribed or you are subscribing to making abortion legal.
What I'm doing is I have subscribed to make abortion safe. And to have it safely, it is to be done by a trained profession, and it should be done at a facility that has all of the necessary equipment in order to make sure that it is safe.
0776-540-987 or better still 0880-514-096. That's the numbers to call and you are live on the SMS. Again 0776, that's the alternative line, 540-987 or better still 0880-514-096. You can call out of those numbers. You are live on the Super Money Show. Our guest here is Dr. Francis Kateh. Dr. Kateh is the Chief Medical Officer of the Republic of Liberia. The first caller. Good morning.
Good morning, Brother Sorbor.
Good morning.
Yes. Thank you for the program. Let me say thanks to the doc for the explanation. The question that I have on mind is, what can he do to help secure the medicine that are being sent to government facilities? Because we are victims. Even right now in Banazé Health Center, you got common malaria, you go there, they will only eat people. And sometimes you get sick, you don't have money. But we are told that medicines that are being sent to government hospitals are being taken by the very health practitioners. But I believe there's a method that can be put in place, of which I believe that it can help.
Okay.
Thank you.
Many thanks. Let's take this call on the line also. Good morning. Good morning.
Thank you, Sorbor. This is Grimsby. I'm impressed with Grimsby, and I call for Grand Bassa County, the son of Rosses County.
Let's hear from you, sir.
Thank you. You know, it is good to do everything professionally. And when I say professionally, it means that you go to the requisite authority, wherever you want to do, that it will go well. And so, what I want to ask Dr. Kateh, there's a farm hospital built in collaboration with the government of Liberia in Rosses County. Whenever I pass that place, it really, get to me, and then I try to take some photos, to be bragging about it. But since then, the building is there, it's not open, so I want to know what's the plan from the government angle that open up very beautiful facility that will serve as a referral hospital for Sano County and the rest of other county closer instead of going with Grand Bassa County.
Many thanks. You made your point already. Let's take this call on the line. Good morning. Good morning. Good morning. It seems that the caller is off the line. Let's take this other caller. 0776-540-987 or better still 0880-514-096. Good morning.
Good morning, sir.
Yes, good morning, sir.
My name is James Scabian. I'm a visually impaired. But I just monitored that Kateh very well. My first concern had to do with no drugs at the Liberia Health Center, and we tried to justify. Yes, indeed, we say no drugs. It is mandated for Dr. Kateh to tell the public that we are going to visit our essential drug guideline. This is something that needs to be done nearly every 2-3 years. Based on our disease condition in the country, you have to visit it to know that what are the drugs that are necessary to always be on hand. But if I happen to go for malaria treatment at JFK, and you begin to tell me, say, no, I'm a doctor not here. They want not here.
Hello? Oh, he's off the line. Let me take this other call on the line. Good morning.
Yes, good morning.
Yes.
Sorbor George, good morning to Dr. Kateh.
Yes, sir.
Thank you. This is Phil Tomula Jedu, the Popo Defender from Looking Town. But let me applaud you and Dr. Kateh this morning for the explanation, more especially that whenever you mount the podium, they ought to understand more things. So what some of us are one of those who are going against legal lasting abortion, but for nation some of us, then aside with him, even those who propose this, because some of us, if you have abortion that is legalized, even those men that went behind the wall, at the final analysis, some of them, they would, like you said, they would take something from there, and then they to have a specific move, have for them, some of them, it lead to their death. So when it's legalized, they will have the fear, and whenever they want to do it, they will go to that designated area. Instead of anybody can just wake up and then do abortion. Thank you very much.
Many thanks also. Let's take this call on the line. Good morning.
Good morning, sir.
Good morning, sir.
And good morning to Dr. Kateh. And this is Ojuko. Ojuko.
Yeah, would you go over here quickly?
This issue about the abortion bill have been a concern in Liberia. And for your explanation, I think it is prudent enough to be explained to our people in a very vernacular and dialect. Because there are misinterpretation evidence. And Liberian
Many thanks. Let's take this call on the line. Good morning. Hello? Oh, we're trying to. Good morning.
Sir, good morning.
Good morning, sir.
I'd like to salute the CMO in studio this morning for his presentation. My name is David Shea. I join you this morning from District 6.
Okay, Dave.
Three issues and I'll be concise. The first has to do with the current outbreak of measles in the country. We have noticed that there has been a challenge in getting the drugs to various private health facilities because many private health facilities are now doing referral for the issue of measles. And I think measles is just one common thing that the Ministry of Health should be capacitated to give all those necessary, medical supplies to private health facilities so that they can help government in combating. So I'd like you to speak on what the shortage in the distribution of drug acting for the measles vaccine. The second one has to do with generally, Dr. Kateh, there is a challenge. We need to admittedly there is a challenge with the issue of drug. When you go to government facilities, we understand that the patient rate is very huge. We understand that the challenge government faces is very enormous. But the truth of the matter is that there's a challenge. Places you go, they will do good examination, or when it comes to giving you drug and other medical items, they will mostly write a paper say go to this place, you go and buy it, try to get it. And I don't think that is the essence of going to hospital. Going to hospital, especially government hospital, because we think that government hospitals are the ones that are equipped with the necessary human resource. So when we go there,
Dave, you said that you would have been briefed now. We got others on the line, please.
Lastly, this issue of legalizing or whatever of abortion, I think is important. The reason I want to support his argument on that is because of the trauma afterward, how many people get affected afterward. So we think that it is done on a proper supervision and monitoring, especially in consultation with government and the requisite medical practitioner to conduct that. I think it would be important because even if you don't legalize it, the thing is already ongoing. So what can we legalize it to help control the issue of people having post-abortion effects? Why can we do that? So I support the argument on that. Thank you very much.
Many thanks. We are not taking additional calls. Let's go back to Dr. Kateh to respond to those concerns and we'll wrap it up with him. Doug?
Sure. Thank you so much. Again, I'm glad that people were able to know there are a lot of persons out there that have so much. So let me quickly talk about the few things that have been. Let me start off with the outbreaks and so forth. Yes, indeed, we had an outbreak here, and this is something that we anticipated. Again, remember during the time of COVID, many persons were afraid to take their children to the facility for vaccine and so forth. Some of the vaccine we had expire. Yes, that is now post-mortem. We have enough vaccine, measles vaccine in the country, and we're anticipating more, and this is it. But most of the government facilities that have the cooling mechanism to maintain these vaccines, they should have vaccines there. And so we are doing that. In terms of giving it to private facility, that is a different mechanism that we have to. Because to give a vaccine to a private facility and so forth, we all have to sit down and see what is the mechanism in terms of accountability and so forth. So that's something we need to look at. Yes, indeed, you and I, we all agreed at facilities. This is not something that we are trying to lie about and so forth. We know that there is a challenge within the health system, especially when it comes to medication and so forth. And this is why it is prudent for every one of us, because there is nothing free. I gave the thing that when Liberia had crisis, there were a lot of support. Now we have been stable. So now we have become independent, and when you are independent, you need to start to fend for yourself. So it is important that we all begin to fend for ourselves, and the sooner we do that, the better it is that we're going to curtail these challenges that we have with pharmaceuticals and so forth. In terms of abortion, so the abortion portion is just a minute of the public health law. So there is a public health law that was passed in 1976, Sorbor. So there are things that we are doing now that does not conform to the public health law based on how it was written. And so the entire thing is a humongous document. It's only a minute that talk about making sure that we have safe abortion. So it is more safe abortion than the act of quote unquote legalizing or this and that with abortion. No, we want it to be done safely, and I'm glad that others have seen reason why they think it is prudent that it's being done. So again, in terms of the hospital in Bedia, this hospital is in Bedia, River says, and we want to say a big thank you to the German government. This was done in collaboration with the German government. We are working very, very hard. So very soon, my young man, that facility will be open. We had a little hurdle, but that hurdle has been cleared now, and very soon we'll be discussing with the elders, with the caucus of River Says, and plan the appropriate activities in order to have that open. Last but not the least, securing medicine is something that is very difficult, but we also ask the public to help us because we cannot be at every facility.
Sure.
The public need to help us. If they see medicine developing legs or developing tires and running away, please let us know where they are running to so we can be able to stop
So
them.
we can go and grab them, right?
Thank you so much.
Okay, Dr. Kateh, thank you for taking time off a busy schedule this morning.
You are always welcome.
We'll be